Okie doke. So welcome everyone. My name is Maureen Tops. I'm the CEO of the Medical Council of Canada for a few more weeks. It's been my absolute privilege to have been able to participate in this amazing project that the MCC currently is well engaged in. And because we've had so many requests for information from multiple different organizations, some of you we have talked to already, some we have not. We thought the most best use of everyone's time was to actually provide a formal information session, and then we have a little treat for you at the end. I'll get to that once we go through our presentation. There will be plenty of time at the end for questions, so perhaps hold your questions to the end. And when you are asking questions, if you could identify yourself by name and also the organization that you are representing on the call. We do like to keep track of these things, and thank you so much for when you registered indicating the organizations that you're coming from. We have a number of MCC staff here on the call who've all been very engaged in the development of the National Registry of Physicians. And we also have, I think, a number of the working group members from our medical regulatory authorities who've been so instrumental in helping us to move this forward. So plenty of people to answer any of those difficult questions that some of you may have at the end. So Doug, I think you're going to drive the slides for me. So why don't we just jump right in and get ourselves started? And as Doug's getting that set up, I think the big thing to start off with is a fantastic thank you to the Government of Canada Sectoral Workforce Solutions Programme, which was a new initiative started as a result to the discussions on the healthcare human resource crisis, probably 18 months, 2 years ago now. And this project has been funded by the Sectoral Workforce Solutions Programme as part of the Government of Canada's support for initiatives looking at the healthcare human resource crisis. So on to the next slide. Thanks, Doug. And thank you, Catherine, for just reminding me. We do like to start off our meetings just acknowledging that the Medical Council of Canada is located on the unceded, unsurrendered territory of the Anishinaabe Algonquin Nation, and we are very, very privileged to live, work, and play in this beautiful, beautiful environment. And I certainly encourage everyone to reflect on where they are currently joining from. And if you wish to, you can certainly put an acknowledgement in the chat also. So appreciate that. Thank you. So when the MCC received this funding from the Government of Canada, it came as part of a multiple project submission. So we have what we call Stream 1 and Stream 2. Stream 1 really focuses on some of our assessment capabilities and competencies that we test physicians on. So I'm not going to say any more about that, but just to acknowledge that part of the funding did include support for these activities. And today we're really going to focus on Stream 2, which was to establish the National Registry of Physicians. And the next slide shows you very nice branding that we have put in place. If you take Stream 2 out, the rest of the slide highlights the branding that is in place for the National Registry of Physicians. And this has been designed very much to demonstrate the collaborative, interlinked nature of the National Registry of Physicians. And hopefully I will be able to demonstrate that to you as we progress through the presentation. So next slide, thanks, Doug. So what is the National Registry of Physicians? So it's really designed to be the first nationally integrated source of data on physicians in Canada. And it really came about because there is a tremendous amount of data that's held about physicians in various different organizations across the country. If you think about medical regulators, if you think about CAPER, if you think about the Medical Council of Canada, if you think about health authorities, if you think about funding agencies, if you think about workers' compensation, it's all over the place as to where information is held about physicians in Canada. And so this project really is in progress progress to be the first nationally integrated source of data on physicians in Canada, and really to function as that centralized information exchange, which we really hope and anticipate will allow improved collaboration across the jurisdictions and consolidate this very valuable physician data in a centralized location. And the way to think about this is that the MCC will own and operate the infrastructure that supports the National Registry of Physicians. The data will actually come from and continue to be owned by all of the medical regulatory authorities of Canada at a starting point. So on to the next slide. Thanks, Doug. Eventually, though, we do hope that the National Registry of Physicians will eventually provide the foundation and the platform for many, many different sources of data and uses of that data. It really was envisaged as providing that time-critical information on physician credentials that really supports the licensing initiatives for our medical regulatory authorities. The process at the moment, if a physician moves across the country from a different location from one regulator to another, it can be quite a cumbersome process to share the information that's necessary and for physicians to actually get that all-important license to be able to provide healthcare services. And we saw this a lot through the pandemic, where we needed to redeploy physicians and they may be moving across from jurisdiction to jurisdiction. We saw it with support for intensive care, for pediatrics, for emergency rooms, for rural medicine and communities. And it became very, very clear that being able to share information in a very timely manner in order to for licenses to be granted expeditiously was a bit of a challenge. So the redeployment issue is certainly something that we need to be paying attention to. But I think there are other pieces of information that regulators really need in order to be able to license physicians. And that includes things like, does the physician have any disciplinary findings that they need to be made aware of before they issue a new license? We certainly see this as providing support for modelling and research on health human resources planning. And the notion of a national locum pool and the ability to really support that mobility of physicians across the country. We know that certainly in rural and regional communities, having availability of services to provide vacation support or fill in gaps when the service provision is no longer available, that those are critical issues that we really don't have a good approach to currently across the country. We do see that this will have the opportunity to integrate with many other national services. CIHI at the moment provides a tremendous level of detail on physicians in Canada, but the information is months out of date often by the time it's provided. And the way that the National Registry of Physicians has been envisioned is to provide very current, in the moment, timely data of the key information that's needed to make those licensing decisions, to allow mobility of physicians, allow redeployment of physicians, and to provide that all-important support for modelling of where physicians are and hopefully eventually what they're all doing, because scope of practice is a gnarly issue that has been a very tough nut to crack. On to the next slide. Thanks, Doug. So the benefit, I think, the value is pretty self-evident, and certainly with the number of organizations, groups, individuals who've been incredibly interested in the development of this national registry, it really will provide tremendous value, particularly for the medical regulators to start off with. It's really the data exchange that they need in order to be able to provide the licensing activities. A single interface using medical registration information with a common profile. The data will be accessible to the MRAs. It'll be accurate because every time you send in a new application, errors can be made in that application. So accuracy is hugely important. It will be searchable. It will be current. As I've noted, this will be updated on a very regular basis and provide very current information. The team has spent a huge amount of time looking at privacy and privacy compliance and security issues because, of course, this data on physicians is incredibly valuable and has to be protected. It has to be kept confidential. So I'll get to a couple of slides later. There's a tremendous amount of effort been put into ensuring state-of-the-art security and privacy compliance for this data that's being held within the registry. What about other stakeholders, however? Initially, this will be used by the medical regulators, but many other stakeholders will see value in the National Registry, including our governments for planning purposes, both federal, provincial, territorial. We certainly plan to link and partner with CIHI, and we've had discussions with CIHI already on the National Registry of Physicians. The Centre of Excellence for Healthcare Information is underway and under development, and again, we're talking to the individuals leading that. The MINC number is very important, the Medical Identification Number for Canada. MINC is a separate independent organisation and was very clearly identified as the unique identifier that would be used as the link within the National Registry of Physicians. And the good news is that over 93% of physicians in Canada already have a MINC number. And so this of course, made it very simple to decide what the unique identifier would be within the National Registry of Physicians. Public will eventually have access also to be able to search specific questions around physicians. So we do see this providing tremendous support for care delivery, for enhanced access for patients. We do see for future disaster preparedness a huge potential for being able to redeploy physicians to areas of need. Certainly a potential for supporting a national locum pool for particular service capability, and the all-important planning that we need to do to inform all those requirements for our funding providers, both provincial, territorial and federal, when you're thinking about the health sector, which of course is a very large economic driver for Canada. Next slide, thanks, Doug. So how has this been designed? So it's really been designed as a cloud-based registry, that data information exchange, with MCC operating the registry as an agent of the MRAs who will continue to own the data that they provide to the registry. There's been a very engaged medical regulatory working group who've been in place just over a year now. And they have been spending a tremendous amount of time defining all of the specific registry components, making sure that this is consistent, that it can be shared across the different locations, while continuing to stay within the provincial and territorial regulations that each of them are bound by. I've mentioned already that we are leveraging the MINC number as the primary index. It is widely available with large numbers of physicians already having a MINC number assigned. The MCC also provides the services of physiciansapply.ca, which connects to the application for medical registration, which our regulators already use for credential verification and licensure decision-making purposes. And so we've made paid very careful attention to making sure that the information and the data held in Physicians Apply can seamlessly integrate with what is needed for the National Registry of Physicians. We have spent a great deal of time talking to different organizations and groups, and we certainly hope to continue that collaboration with the many interested parties as this National Registry of Physicians unfolds. So if we go to our next slide, this just gives a little bit of a graphic of what is the NRP. So think of the NRP as a sort of this data exchange platform which has inputs and it has outputs, and it has the support of MCC support services, the MINC number, and the information in physiciansapply.ca. The information will flow into the registry from the MRAs, and then the MRAs will also be able to access and query that information and use it for their own licensure purposes. Eventually, you see over there on the left-hand side of the screen a box there that says Other Users, and that is certainly future potential for the NRP. But I do want to emphasize that the first users will be the medical regulatory authorities, because it is their data that will be held within the NRP. On to the next slide, please. Now, the next one's a lovely slide. And this just gives you a hint of the level of detail that has gone into the Medical Regulatory Authorities Working Group as they have defined the core data model that is being used to populate, that will be used to populate the National Registry of Physicians. So you can see all of the different categories, and yes, all of these were identified, looked at, reviewed with a location-specific lens, with a regulatory lens, with a legal lens, in order to come up with that common core data model, which has now been implemented and is being built into the architecture of the NRP. So I just wanted to show you that slide because it's actually quite, it shows the level of detail, and this is simply the core data model. There are many other potential future additions to data models, and anyone who's built any kind of data system will know that getting through a model like this is not easy. But I will say that the core working group has been absolutely such a collaborative, amazing working group, and they have done their due diligence, and this has been tremendous. So, next slide, thanks, Doug. So we did establish this working group. It's been in place since October of 2022. It was one of the first things that we did as we started off with this project. And I'm going to tell you a little bit about the timelines of the project, because everyone will know that it was probably January, February of 2022 that we started to hear about some potential funding from Health Canada. We were invited to submit a proposal to the new Sectoral Workforce Health Solutions program. We did so. We heard, I think, around June that we were going to be receiving some funding, but the funding contract was not actually signed until October. I will say thank you very much to the Health Canada and the Government of Canada again. This was lightning speed when it comes to government grants being approved, but we did start to work on the project probably around July of 2022. The deliverable is March of 2024, so you can think about that timeline, and that is an absolutely massive project to complete and conclude in that very short time frame. So one of the first things we did was to convene this working group in October 2022. And the members really are the regulators who are participating, MCC and FEMRAC. It's been chaired in a very productive manner by Dr. Heidi Otter, who's current registrar of CPS BC, about to retire. And we thank Heidi tremendously for the level of effort that she put into shepherding this process forward. So the initial requirements really were the core data elements, and very importantly, those disciplinary findings that are so important for regulators. And just another reminder that the MRA retains ownership of all the data that will be held within the National Registry of Physicians. We are on track. Thank you very much to Doug, who's been our project lead through this process. We actually hired him before the contract was signed, and we were so confident that we were going to move this ahead. And Doug has done an absolutely amazing job of leading a very large team of both internal staff and hired contractors to move this project forward. And we are on track. We are on budget. We are on time. Through this remarkable activity to actually deploy in March of 2024. Next slide, thanks, Doug. So we were very fortunate also, as part of the proposal and the funding of this project, to be able to include some financial assistance for the participating regulators in order to support them with the necessary IT transformations, the legal updates, the policy updates, anything they needed to update on their own systems end to be able to support the data exchange that will populate the National Registry of Physicians. We have had a very detailed privacy impact assessment, and it's been seen and reviewed by all parties. We have had many information sessions. I've referred to those, and this is another example of the sort of activities that are going on. We are very close to completing the terms of reference for a Data Governance Advisory Committee, which will be a subcommittee of MCC's Council. This committee will really oversee how the data held within the National Registry of Physicians is used, and it will be primarily populated by the medical regulators. You see the membership there, which includes medical regulators, MCC, MINC because of its role as the unique identifier, Health Canada as the funder, and we also anticipate adding someone from the Committee on Health Workforce in order to have and maintain that link with the provinces and the territories. We were incredibly fortunate as we were submitting the proposal for the NRP that 12 of the 13 regulatory jurisdictions did provide us with support letters for this, and that was very remarkable in the short turnaround time that we had to put this proposal together. Next slide, Doug, thanks. So the next couple of slides really go through, I've paid a lot of attention to the security and privacy aspects of this because, of course, data that's held about individuals has to be really, really well secured, maintained, and kept secure. And this sort of highlights that we have really paid a great deal of attention to the industry regulations and standards, that it supports the updates that might be necessary in the future for technology updates, and many controls put in place across different domains. I know very little about this, so if you have questions about security, or if we go on to the next slide around privacy, we have experts who have been hired to make sure that we pay very good attention to these very important and critical areas of the NRP. On the next slide, Doug, thanks. So the focus on privacy has really been front and center right from the outset. And we did conduct a privacy impact assessment looking at every organizational area that we were engaging with. It has been anchored by 10 very discrete principles of privacy protection, and really takes into account best practices and controls that are necessary with continuous adaptation, because of course the privacy landscape, freedom of information, personal protection of personal information, it changes all the time. So this is something that's incredibly important. Next slide, thanks. So this really just gives a very high-level overview of where we've got to in terms of the various milestones that are happening. October to December really refers to this year because the whole prior year was spent sort of collecting the information, designing the architecture, starting to build the architecture. But you can see we've been focusing on many other activities also. The requirements for the data have been frozen. They were frozen about 3 or 4 weeks ago so that the final build could be completed. We are in the process of working with the various participating medical regulators on the participation agreements. They have been sent out, adapted, updated, legal review, and we're hoping that those can move ahead before too long for signature. This is the all-important agreement that will allow the data sharing with the National Registry. We're about to launch user acceptance testing. It's coming in the next week or two, I think, to all of the participating regulators. We are working very closely with the Government of Canada on ongoing funding and operational funding. Some learning and training modules are under development, and we really are very well set for this project to be completed on time and ready to launch at the end of March 2024. Then, of course, after that, that's the start of operations, which means that we need to start to onboard the data from the medical regulators. We need to think about the ongoing requirements for data. We need to think about the ongoing partnerships and collaborations that are necessary. So this is really just the starting point. Very much think of it as the basement of the house that's about to be built, but a huge milestone to actually get the basement completed and very solidly constructed. Next slide. So future direction, we do see many features being included to support physician mobility, multi-jurisdictional licensing, portable licensing. We do see it as being incredibly useful for the support of health sector planning. There may be some questions about the Atlantic Registry and how does this fit. The Atlantic Registry has been a very excellent starting point for multi-jurisdictional engagement, and this National Registry will absolutely support that type of model, and the Atlantic provinces have been very key in the engagement of the development of the National Registry, which is a very scalable situation, whereas I think the problems with the Atlantic Registry is they're dealing with very small numbers of physicians and a very manual process. So I think they'll be quite pleased to see the scalability within the National Registry of Physicians. AMR stands for the Application for Medical Registration, which I referenced earlier. And of course, the National Registry of Physicians, because of its impact on licensure, will integrate very closely with the application for medical registration. The Data Governance Advisory Committee will be established by MCC's Council, hopefully in the very near future. We will then populate that committee, and they will then start to develop the policies on how the data will be used, what other types of data might need to be collected, aggregated, used, etc. going forward. So this is very much a work in progress, but very important activities going forward. So I think that's the end of this presentation, but I did promise you a little treat at the end here. And that is that we have expedited the production of an informational video in anticipation of this information session. And it's just hot off the press, so you will be the first to actually see this video. It's not yet available in French, but it will be very shortly. But we did want to showcase this, and then it's a very short video. Once it's finished, then I'll be very happy to take questions from anyone who would like to ask anything. So please, Doug, if you want to play the video, thank you.
Recent years have highlighted some of the challenges facing Canada's healthcare system. Patients may be frustrated by obstacles such as doctor shortages, access to specialists, and long wait times for care. Physicians may be frustrated by obstacles to collaboration or meeting licensing requirements, and governments by the inability to rapidly deploy them where needed in Canada. These barriers mean Canadians may have trouble accessing and receiving the quality care they need, when and where they need it. The National Registry of Physicians is designed to help reduce some of these barriers to care. Set to launch in 2024, the registry will serve as the first nationally integrated list of data on physicians in Canada. It will collate data from medical regulatory authorities and house it in one centralized location, enhancing the accessibility, accuracy, currency, and searchability of physician profile information, while enabling improved collaboration across jurisdictions. The National Registry of Physicians will help MRAs and other stakeholders to better access physician medical registration information, support health sector research and data modeling, make decisions around healthcare planning and resourcing, empower recruitment and retention of physicians in underserved areas, optimize licensure and business processes to improve service delivery, and respond to disasters and public health and safety crises. It will help physicians by making it easier to meet licensing requirements, deploy rapidly, or deliver locum service or virtual care to other parts of Canada, as well as benefit from knowledge and best practices that MRAs in the provinces and territories will be better able to share. And ultimately, it will be a first step to help improve access to safe, high-quality medical care for more people across Canada.
Thank you, Doug, for that. And also to our communications and marketing team for all the work in putting that amazing video together. So we have plenty of time for questions. Happy to open things up. And if you wouldn't mind, just please identify yourself and the organization you're with, and we will be happy to take some questions. Thank you. Owen, I see your hand up. First one up there. There we go.
Thank you very much, Dr. Tops. This is very exciting. I was just wondering, like early on, you'd sort of indicated that there would be sort of a requirement for ongoing operational funding, at least in the first few years. And I was just wondering if there's been if you have any news on that.
So, like I said through the presentation, when we're actually working very closely with the government of Canada in terms of looking at that, we certainly, as you know, you participated, and thank you very much to the CMA for the support in this. We did commission a report at an early stage of the National Registry looking at sustainable funding models, and this will certainly be a continuing area of focus going forward. But we're hopeful that we will have some early operational funding and be able to continue the development work and implement with the MRAs come April. So
Great, thank you very much.
Cautious good news, but I can't be too more specific at this point.
Great.
Sheila. Hi, Sheila.
Hi. Thank you, Dr. Tops. My name is Sheila Beeler-Walsh, and like Owen, I'm with the CMA. So a massive congratulations to the team. That is such an impressive project, and I continue to be so impressed that every time you say on budget, on target, and still continuing to launch in April of 2024 is a huge kudos to everybody working on this. So it's launching in March. So does that mean as of April, all the information will be up to date and in the system starting in April? Or does it eventually sort of do each MRA come on board? Like, when will it be operational? And I think the second part to my question is Ontario still not part of the initiative? And do you envision that they will jump on board?
Yeah, so thanks very much, Sheila. Great questions. So yes, the foundation will be built. It will be ready to receive the information from the MRAs as of April. That's certainly, Doug will certainly comment on that. At that point in time, sharing of the information really relies on the MRAs having completed those data sharing agreements that we're currently working on. And we anticipate also, similarly to when the physicians apply and the application for medical registration went live, it was really an iterative process where regulator by regulator came on board, and it actually happened over a series. It was probably a month or even several months up. I think it was up to a year before everyone actually came on board, and we anticipate that will be something similar to the NRP. We anticipate starting with probably one regulator porting the information, doing some testing, making sure it works, etc., etc. But a lot of it depends on those data sharing agreements, which are absolutely key, and those are with legal and under review at this point in time. Your question about Ontario, yes, Ontario is still not part of the process, although we continue to be hopeful that they will join sooner than later, and we look forward to having them as part of this process also.
Great, thank you.
Mm-hmm.
Oh, sorry.
It's your hand back again.
Yeah.
Any other questions? I see Marion.
Hi, I'm Marion Williams with the Pediatric Chairs of Canada. One of the concerns that we had shared earlier was that when the information was being gathered, that the pediatricians would be counted, but not necessarily the subspecialists. So in one of your first slides, I couldn't tell whether or not the subspecialty would be in fact captured for the pediatric workforce.
So thanks, Marion, and yes, thank you. We certainly appreciated the conversation that we had with the pediatric chairs. So yes, subspecialties will be captured. It's part of the core data set that MRAs already capture and will be included in the National Registry. And certainly the other types of data that potentially could be captured, certainly we understand that there are some special areas of interest that may not be readily accessible. Those sorts of extra data will be under consideration by the Data Governance Advisory Committee as to how that could be captured, collected, used, etc. So, but yes, subspecialties are part of the core data model.
For pediatrics, great.
Yes.
Thank you.
Doug, did you want to make any comments on any of the questions that have come forward so far?
Yeah, sure. So with respect to onboarding, as Dr. Tops stated, the build will be complete and ready to onboard at the end of March. We plan 2 cycles of user acceptance testing. The first cycle is December 4th to 15th with a not right production ready view yet, but we have most of the MRAs planning to participate. And then we'll do a second round of formal UAT with the candidate production load, February, March timeframe. And then in March, we'll be ready to actually start onboarding the MRAs. When you look at the core data model, there's 3 sets of specialties, right? You have RCPSC focused competencies. We have CFPC added competencies. And we have SEAP subspecialist examination affiliate program. So the core data model is as stated there, but we designed it to be extensible. So the whole idea is it's basically a structured standard database schema, and we can extend it, plan to extend it through time, if that helps. Yeah.
Eventually, the little video about the NRP will be on our website, which is currently being redesigned at the present time. But Catherine, I don't know if you want to talk about who all will be able to access it and the French version.
Yes, so we wanted to prepare the English version of the video, and thank you to Julia Doyle, who's on this call, who spearheaded that for the purpose of this meeting. But we are still waiting for the its French version to be finalized. So we expect that we will be able to circulate that and put it on our website once it's available. That will probably only be in the new year. So thank you for your patience on that.
Michelle, hi, Michelle. Oh, I'm not hearing you.
Maureen, thanks so much for your presentation. Thank you for enabling me to participate. I'm Michelle Hunter, Rural Ontario Medical Program. Of course, when someone starts to build a basement, they're excited to see the rest of the house being built. So thank you for that analogy, because we see where this opportunity can take us as we experience challenges at the coalface in communities and mobilizing not only physicians but residents in and around jurisdictions. Thank you for identifying the outstanding jurisdiction, and we are very hopeful that that's a possibility for the future. So any supports that we can work with, we do have folks that are working on the OMA HHR committees. So certainly if we have the ability to support that, the repository of the registry in Ontario, of course, does struggle to be current. So as we are frequent flyers with using that registry. So we are looking forward to any support that we can also offer to mobilize to keep things current in any environment.
Yeah, thanks so much, Michelle. And certainly the OMA has been very supportive whenever we've had conversations with them on this. I think one of the questions that you didn't ask, but I'm just going to answer, and it may come up, is will residents be included in the registry? And the answer is not to start with, because it will be fully licensed physicians to start with. But I think, as Doug mentioned, we've built this to be expandable, whatever the right term is. So I anticipate that, because movement of residents and students is also very important, and many of them are licensed in different jurisdictions. Ontario is actually the exception for medical students as well, but other jurisdictions do actually register medical students also. So I see that as a future build on the basement also. So, but thanks, Michelle.
It sure is. So thank you so much.
Samantha, hello, I see you.
Hi, sorry. Hi, I'm Samantha. I'm the Director of Registration from Ontario. So I just wanted to jump in to connect with Michelle, because our registry updates every 30 minutes with sort of a live view. So interested to hear what your challenges are that you're experiencing, and if there's anything that we can help you with that. So just wanted to jump in and make connections with you there.
Networking, I love it. Best way to use this kind of a call. And we hope to talk to you soon, Samantha, as well. So
definitely looking forward to it.
Yeah. Was that an old Michelle or a new hand?
That's an old hand, but
an old hand. Okay.
We'll go offline with Samantha and catch up on those.
Sure. Lots of time for more questions. Anything else that's burning a thought in people's heads?
I have another question, Maureen.
Sure. Mm-hmm.
In the beginning part of your presentation, you said that this, and I'm just asking if this is sort of a future build, a potential for a national locum pool. And I was just curious, would that be looked at in the future? Kind of who would facilitate that?
Yeah, so definitely a future-oriented piece. A lot of what's being done, and maybe Doug will comment on this also, is being built. The capability of flags being added to a physician profile, and one of the flags could be that a physician identifies when they renew their registration with an MRA that they are interested in providing locum services in their discipline area. So it's the sort of thing where flags can be added for all sorts of different reasons. And Doug, I don't know if you might want to comment on that, but we certainly see potential and huge potential for something like that to be a capability.
That's great. Thank you.
Yeah, we did have discussions around physician mobility at locums and support for CPCs, etc. Back to the analogy, we had to keep the scope for the foundational build achievable, to the timeline and funding available. But the bones are there now. So again, we designed the data model to be fully extensible to support alternative overlays of data. So a locum can be considered a kind of logical flag. I'm part of locum or not, that kind of stuff, right? Dr. Tops was talking about. So we're confident we can get there. It's really now up to the Data Governance Advisory Committee to give us the policy direction and so on, so we can extend the capability sets.
That's great. Thank you.
So one of the things I had mentioned earlier, sorry, Owen, I'll answer your question first, and then I'll make another comment about something else. So.
No, I can go after your comment, Maureen. Thanks.
Yeah. So I was just going to mention that the initial data set is going to be for physicians who are licensed to provide independent care. So that's one of the key category criteria that started things off. So that's why we won't have residents in there to start with, or medical students. So anyone who comes through any of the alternative pathways, different pathways, internationally trained physicians, if they are eligible for independent licensure, then they will be included in the NRP because the data will flow on their availability of licenses, or their license criteria and the data set that informs that license that will be included as part of the data set. So just in case there were any about that. Yeah, sorry. Owen, sorry, go ahead.
Yeah, thanks. So the health ministers have said then that they would like to see a multi-jurisdictional thing for physicians in about a year. And I was wondering about that. So say like, I mean, the Atlantic Registry is terrific. And I've heard from doctors that have signed up and they say it's great, it's seamless. But supposing, thinking ahead to a national thing, say if like 5% of Ontario doctors wanted to apply to the Atlantic, to something like this registry, I mean, I think the smaller regulators would be kind of swamped.
Yeah.
And so I just
Right.
wonder, would you see like a role for something, how the NRP and the Medical Council could facilitate that, recognizing that I guess that at the end of the day, the regulators still want to issue their own licenses?
Yeah, well, I think exactly that, and I think that this will be a tremendous capability of the NRP in facilitating that. You're right. The big problem with the Atlantic Registry is small numbers and not scalable. So it's a very manual process. Sorry, the sun's shining, and I think I'm disappearing into the screen here. So it's a very manual process, which is not really scalable. And certainly, if someone from a large province, or not a large province, but a province with a large number of physicians who then wanted to work in a smaller province, that would be very problematic. But the whole capability of someone wanting to apply to a different jurisdiction or having a portable license, and their information's in the National Registry, the regulator can search it. It just makes things so much easier, and the information will be very current. The idea is that it will update on as quickly as the regulators update their own information. Some of those do that daily. We heard from Samantha that their registry updates every 30 minutes. So depending on what the regulatory arrangement is for their own updates, that's what how the National Registry will update also. So
Great, thank you.
Yeah. These are great questions, because questions from groups like this will help us to develop even better presentations. And as the video is presented, I'm sure that Catherine and team will be putting some FAQs out there to answer questions. So, and we're really, really, really pleased with how this whole project has gone, and also really with the collaboration and the engagement that we've had with so many different parties around the country. Hi, Marion.
Hi again, sorry.
No,
just a couple of questions. One, language is being captured in the database, is it?
Yes.
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 Yeah, I thought so. I figured it would be.
Yeah. And
Okay.
beyond English and French, because regulators also capture other languages that physicians speak. So we've included a huge but long list of languages, and certainly working with CIHI to make sure that terminology such as that is very consistent and standardized, so that can be shared also.
So when the pediatric chairs did basically a small project years ago around the HHR for pediatrics specifically, one of the challenges we faced was around activity of and versus retirement of physicians. Are you able to track when someone becomes inactive?
Yes,
Short-term?
it will depend very much on, again, it's that flagging system of
Mhm.
inactivity can be for a number of different reasons. It could be retirement, it could be illness, it could be maternity leave, it could be who knows what. So I think, Doug, maybe you're better positioned to answer that one at this point, but there will be a way to track inactivity, yes.
Right.
Yeah, so we met in Ottawa last December to substantially agree on the core data model. And, across the multiple MRAs, there's slightly different definitions for physician status. So we agreed on a fairly abstract definition of active, inactive, and suspended. And it's really up to the MRA to make the decision on their side of what value to pass. So that's where we are now in the core data model for the foundation level.
That's great, only because so many physicians also tend to work part-time, so you'll capture all of that, so we'll know whether or not we need to be producing more physicians if they're coming on part-time or only have part-time status.
Yeah, because I think the strength of this type of approach is that the data will be fed from the MRAs. So if the MRAs agree to capture the data and it can be standardized in terms of how it is captured, then it can flow forward to the registry and then be used in aggregate to determine all sorts of different models. Yeah.
Yeah, that's one of the reasons why we left, detailed scope of practice off the table for now, because it's so difficult to align definitions, right?
Yeah. All right. So hopefully everyone knows where we are and who we are. And if you have any other questions, you can certainly feel free to send them on, and we will do our very best to answer them. If you know of anyone else who would benefit from having access to this presentation, then please let us know. We're delighted to share what's happening about the NRP with this group. Vern Naik, who's going to be the incoming CEO for MCC in January, is on the call as well, and he will be very happy to take these difficult questions once I retire at the end of December. And I think actually, Vern, you're talking to the Canadian Medical Forum about the NRP in a couple of days. I think I'm going to be there briefly, and then you're going to take over and do this as well. So yeah.
Correct. So very happy to shepherd this forward, and thanks to Maureen for all of her tremendous leadership in all of this, taking it forward. Built the foundation, and we'll take it from here to build whatever the rest of the house looks like.
Excellent. Well, I think we will give you back 8 minutes of your afternoon or your morning, depending on where you are. And it's been wonderful to see so many participants and great questions. Thank you, everyone, for those fantastic discussions and conversation. And like I say, you know where to find us. We're happy to share information about this. And I really want to recognize the tremendous team that has worked so hard to put this together, led by Doug. We have had so many individuals within the organization engaged with this. It's been just the most incredible project, and I've been very proud to be part of it. So thank you. We'll say goodbye.
Okay, thanks,
Thank you.
Maureen.
Bye all.